Manoeuvres are for the breech delivery. By definition, the breech presentation is the presentation in which the fetus is in the longitudinal lie and his buttocks is the lowermost part. Next, we look at the manoeuvres, that is a Pinard's maneuver. So it is used for delivery for the extended legs in case of the breech delivery. So you can see it in the image. So the technique is by flex and abduct the popliteal fossa. So you flex and abduct it and catch hold of the ankle and pull down along with abduction. Next includes the Lausset's maneuver. So this is a delivery of extended arms in case of the breech presentation. So what is the technique? It is by holding the sacrum with the thumb and the hip and pelvis with the other fingers. Next, it is to turn the infant 90 degrees to bring the shoulder under the pubic symphysis and deliver the anterior shoulder. Then the counter rotate 180 degrees to engage and deliver the posterior shoulder. Next, looking at the modified Prague's maneuver. So it is used in breech presentation to deliver the aftercoming head back if it returns to fail to rotate to the symphysis. So the technique is the grasp the shoulder of the baby from below with 2 fingers of one hand, and next is draw the feet up and over the maternal abdomen with the other hand. So it is very evident in the image. Next includes the Bern-Marshall method. It is used to deliver the aftercoming head in case of the breech presentation. So technique is to allow the baby to hang by its own weight. So you allow the baby to hang by its own weight, and when the nape of the neck is visible under the pubic arch, grasp the baby by the ankles between the two. Next is to swing the baby in an arc in an upward and forward direction. This is in Bern-Marshall. So you swing it. So upward and downward fashion, you have to swing the baby. This is Bern-Marshall method. Next is Maury-Smellie-Wheat technique. So here it is another method that can be used in the delivery of the aftercoming head. In case of the breech presentation, it is also called the malaflexion and shoulder traction. So technique is place the baby on the supinated left arm with limbs hanging on either side. So you place the baby on supinated left arm and the limbs are hanging on either side. And next, place the index and middle finger as seen in the image. You place the index and the middle finger on the left hand on either side over the malar bones. Next is to place the ring and the little finger of the pronated right hand on the child's right shoulder, the index finger on the left shoulder, and the middle finger over the suboccipital region. So it is seen in the image. Next, the traction is given in the downward and backward direction till the nape of the neck is visible. Thereafter, the baby is carried in an upward and forward direction towards the mother's abdomen.